So yesterday we started nutritional deficiency disorder. Okay, in that vitamin B12, vitamin C, which we discussed. Today we will discuss about vitamin D deficiency. What will happen if vitamin D deficiency happens? So we have diseases. Number one diseases is rickets. Number two is osteomalacia, and third is vitamin D deficiency. Okay, normal vitamin D deficiency. And third one is any hypovitaminosis, hypovitamin D deficiency, or we will call second, third, fourth one is hypocalcemia due to vitamin D deficiency. There is a deficiency of vitamin Ca, calcium, vitamin calcium, or mineral calcium. Next, fifth one is osteoporosis. Okay. Next, last is osteoporosis. So these are the common disorders occurs in the person who have vitamin D deficiency. So rickets means the vitamin D deficiency. So what will happen? So inadequate sunlight exposure. Okay, causes of rickets is inadequate sunlight exposure. So what are the signs and symptoms? Bone pain, delayed growth, or development of bowed legs. This is like the legs will there like that, like you have attached knees. Both knees are attached and their legs shift towards outwards. Okay, knock knees or like this. Okay, muscle weakness or sometime dental problems. Okay, so these are the symptoms of rickets. Next is osteomalacia. So rickets, so what we have to do, we have to give vitamin D supplements or improve the sunlight exposure. So whenever you have calcium vitamin D deficiency, number one you have to do, uh, number one thing you have to do, expose to the sunlight. This is a very important thing you have to advise the patient. Bone pain, muscle pain, anything. Okay. So next is vitamin rich foods you have to give. Okay. Required amount is 600 to 800 micrograms per day. Okay. Whenever vitamin D deficiency occurs, rickets problem occurs, you need to give 600 to 800 micrograms per day. Next is osteomalacia. Osteomalacia means vitamin D deficiency insufficient. Okay. You are taking, but it is not properly absorbed, or it is not taking minimum amount, how much amount your body required. Okay, so what will happen? Same bone pain, muscle weakness, difficulty in walking, fractures in osteomalacia. If some like mostly in old age, they will have fractures. Okay, then what you have to do? Same vitamin D supplements or sun exposure. I will call it sun bath. Okay, so you can take sun bath daily. Okay, advice to the patient, and increase the vitamin D rich diet. Next is vitamin D deficiency. So vitamin D deficiency is you are taking adequate amount, but it is not absorbing. Okay, due to the uh, any medical condition. Okay, due to any medical condition, any problem in small intestine or stomach. Okay, so that's the reason you have vitamin D deficiency. What are the issues? Fatigue, bone pain, muscle weakness, frequent infection, mood changes, or depression. And what you have to take? You have to take vitamin D supplements. Okay, and diet modification, or sometimes you need, if the medical condition is there, you have to treat the medical condition. Next is hypocalcemia. Due to the vitamin D deficiency, there is a lack of calcium in the body. So in that conditions, you have muscle cramps, spasm, numbness, tingling sensation, confusion, or memory loss, and sometimes seizures also occurs. So now you have to increase vitamin D deficiency also, and as well as calcium deficiency. So now vitamin D supplements and sun exposure and vitamin D rich foods, as well as calcium rich foods you have to take. So both you have to check, and you have to monitor the blood vitamin D and calcium levels in the blood. Next is osteoporosis. Osteoporosis is the calcium deficiency. It is also calcium deficiency. Calcium in the bones is uh, is coming into the blood levels. Due to the deficiency of calcium, body is utilizing our own bone calcium. Okay, so it is very chronic conditions. Now you have to do vitamin D deficiency, and at that time you have very painful condition, lose height, weight, and fractures will happen. Okay, mostly leg fractures. So you have to take vitamin D, calcium supplement, and very important. This is a very clinical condition. Okay, and you have to so you have, if you want to healthy your bone and uh, muscles, you need vitamin D and calcium. So so you need to take regular sun bath, regular 10 to 20 minutes is enough for 4 to 5 days. Or if you're taking 20 minutes weekly, 3 days is enough. Okay. If you're taking 10 to 15 minutes weekly, 4 to 5 times. Okay. So these are the requirement of our vitamin D deficiency. And you have to take regular exercise and lifestyle modification, means rich diet of vitamin D and calcium you have to take. Okay. Nowadays, back pain, neck pain, or knee pain are very common. So they are mostly 80 to 90% due to the dietary effect, due to the insufficient vitamin D, due to the insufficient calcium. Okay, due to the insufficient absorption in the small intestine. Okay, so what we have to do, we have to improve our lifestyle. If you moderate, yeah, we have to take in adequate amount of vitamin D and calcium. Okay, so this is very important thing nowadays. Everyone, whoever come to your clinic with pain, numbness, tingling, and muscle spasm and weakness, so means they have an 80% chances of vitamin D and calcium deficiency. So according to diet, food and nutrition, you have to give a rich source of vitamin D and calcium. And for that, you need one thing is common, very common. This is sun exposure or sun bath. Okay. Along with, we will give the electrohomeopathy remedies. We have A3, C4. C4 is good remedy for both calcium and mineralization. All types of mineral deficiency you go through with C4. So we discuss iron, manganese, all this you can go through with C4. Very important. Now come to the topic. Next is iron deficiency. What happened to our body? What are the diseases occurs if iron deficiency occurs? Iron deficiency, first disease is iron deficiency anemia, IDA. This is the most common. Second, iron deficiency in pregnancy. It is the most common. Second is iron deficiency in children, iron deficiency in vegetarian, mostly vegetarian, iron deficiency in elder. So it is according to age group. Okay. So what happened if you are not taking anemia means inadequate or not proper amount of food you're taking, or poor absorption in gastrointestinal disorders, or blood loss, menstruation, gastrointestinal bleeding. So at that time, iron deficiency anemia occurs. So what are the symptoms? Fatigue, weakness, pale skin, shortness of breath, and dizziness. Okay, some brittle nails. So today we discussed also liver. In the liver diseases also you will get brittle nails, cold hands and feet, and headache, cold hands and feet, headache, chest pain. So these are the iron deficiency anemia. So what you have to do, you have to give iron supplements, or mainly diet rich with iron content, like meat, fish, beans, lentils, cereals, etc., etc. You need 8 to 18 mg per day. Okay, for adults. And iron deficiency anemia in pregnancy. So it is also very inadequate amount of dietary intake. Okay, poor absorption, blood loss, or anything. So now you have to go with supplements. So that's the reason pregnancy iron tablets they will give separately, because uh, absorption will happen decrease, and food intake also decrease. So that's the reason doctors advise, mostly gynecologists advise, they give iron tablets, iron supplements. So along with that, you have to take iron rich diet. So in iron, children also same thing in vegetarians. But a vegetarian, what will happen? A vegetarian, what will happen? Limited intake of ham, iron food. Okay, iron food in animal. Okay, so there is a decreased absorption of non-ham iron due to dietary factors, increased iron loss during menstruation. So these are the things. Or there is a electricity disturbance. Okay. So if iron deficiency in vegetarians occurs, why this is happening? Because they are taking vegetarian diet. Okay, hem iron found in animal source reduce absorption of non-hem iron due to dietary factors. Okay, so the hem present in animal, the non-hem present in vegetarians. What will happen is absorption is less. Animal source iron having more absorption than vegetable iron. Okay, so there's the reason they have to take more than required amount, more than required amount. Okay, like 14 to 33 milligram per day, according to age and gender. So these are the important things. So, so whatever iron deficiency happening, it is due to the lack of intake, lack of dietary intake, or lack of absorption in the small intestine, or medical issues. Due to this process, they have iron deficiency disorders. Okay, so what you have to increase the intake. We have to improve our gut health. Okay, next is we have iodine deficiency. Iodine deficiency. Iodine deficiency. Deficiency disorder will leads to different types of diseases we have. Okay, let's see what are the different types of disorders we have. First thing is iron deficiency leads to thyroid gland hypothyroid mostly. Okay, hypothyroidism, and we have cretinism, cretinism, hypothyroid. So if an iron iodine deficiency happens, Why happening? Because inadequate amount you are taking. Okay, low amount of iodine content in soil, water. Okay, and what happen if you have thyroid disorder also? Then only iodine absorption also not happening. Okay, they have thyroid gland goiter, enlargement of thyroid gland. Okay, and fatigue, weight gain. Okay, intolerance to cold. Okay, so these are the sign and symptoms if iodine deficiency occurs. So what you have to do, you have to increase the iodine intake. You have to take iodine rich salt, iodine rich food supplements. Okay, so need 150 microgram per day. Okay, cretinism is very severe iodine deficiency, mostly in pregnancy. Okay, what will happen due to that? The brain development will not happen properly. Okay, so that is the reason in pregnancy mostly doctor advised to check hypothyroidism. Okay, so what will happen? What are the symptoms? Mental ability. A child cannot be able to grow. Mental ability will not grow. They have doesn't have intellectual, okay, impairment. So all these are symptoms of cretinism. So what happened? Early detection is very important. So they will check the thyroid test, will done iron, thyroid, and sugar. These are the important things during the pregnancy. From 3 to 4 months, they will check this because our diet is not good nowadays. Nowadays we are taking inadequate food, not proper diet we are taking. So there's the reason we are getting these types of diseases. If you take adequate amount, so our body will be healthy. Okay. So this is about cretinism. So you have to increase the intake of what? Iodine. Now is hypothyroidism. Hypothyroidism is also due to the deficiency of uh, iodine. Okay. So how much amount in the cretinism you have to take? You have to take 250 mcg per day. 250 mcg per day. Hypothyroidism, it is the prolonged iodine deficiency. Prolonged iodine deficiency. And sometimes autoimmune disorder, any autoimmune disorder is there. Okay. So you have to check this. What will happen? Severe fatigue, weight gain. These are the symptoms. Constipation, dry skin, hair loss, depression, cold intolerance. So if you have cold intolerance uh, along with iodine deficiency, means it is hypothyroidism. Very important. So what they do? Hormonal replacement. They will give thyroxine hormone or sometimes iodine supplement. Okay, if it is due to the hormonal imbalance, they will give thyroxine. If it is due to the iodine deficiency, they will give iodine supplement. Okay, so according to the condition, you have to treat the patient. Now is thyroid goiter, enlarge of thyroid gland, goiter. So it is a swelling in the neck, difficulty in swallowing, difficulty in breathing also. So it is due to the iodine deficiency, inadequate amount of iodine you are taking. So you have to increase the iodine consumption, okay, and regular thyroid checkups. Okay, you have to do this. Goiter. Now is we have calcium deficiency. Calcium deficiency. Already we talked about vitamin D deficiency. Now we talk about calcium deficiency. In the calcium deficiency, already you discussed about hypocalcemia and osteopenia, osteo, osteopenia, osteoporosis, okay, tetany, okay. So these are the diseases of calcium deficiency. Calcium deficiency means same if you are taking not taking vitamin D or else you are not taking calcium. Is there absorption or lack of vitamin D in? Your diet or lack of exposure to the sun leads to all these problems. So we have muscle pain, cramps, tingling sensation, sometimes irregular heartbeat. Why? Why do you have irregular heartbeat? Can anyone tell me this? In the hypocalcemia, why do we have irregular heartbeat? Hmm? Okay, last can answer that. Okay, calcium, what we have to replace with calcium supplements, diet. Okay, vitamin D deficiency can be treated with the help of sun exposure. You need to take 1000 mg per day, 1 gram. 1 gram calcium is needed in hypocalcemia. Osteopenia, it is reduced density of bone. Reduce the density of bone. Okay, so here risk of factors, pain, loss of height, you can see in osteopenia. Same calcium supplements, calcium rich diet you have to give. Same 1000 mg per day you need to give. Osteoporosis already discussed. Next is last is tetany. Tetany is a severe hypocalcemia deficiency. Okay, due to the parathyroid glands. Okay, parathyroid glands which absorb calcium, which release calcium into the bloodstream if there is excess amount. So they will do the calcium absorption and releasation. So what happened in tetany? Muscle spasm. So the mainly the spasm occurs in hands and feet. Okay, and numbness and tingling sensation, and sometimes seizures also happen. Respiratory issues also. And in this condition, what will happen? They will give intravenous calcium infusion and vitamin D supplements. So to treat that, and after that, you have to need to take dietary substances to treat mostly hypocalcemia. Hypocalcemia leads to tetany. You have to take 1000 mg per day, 1 gram per day. So these are the most common nutritional deficiency disorders. So I think you understood about most common nutritional deficiency disorder. So this is the important chapter we need to understood that. Next chapter we will discuss tomorrow. New chapter. Okay. So what we are going to study next is that